right, it is 12:03. We want to respect everyone's time, so we're going to go ahead and get started. My name is Rex Jarrett. I am the Director of Professional Programs here at UMBC. And if you are looking for the University of Maryland, Baltimore County Pause and Pivot webinar series for impacted federal workers and government contractors, you are in the right place. Today's presentation will be on leveraging experiences for your career for anyone looking to make that transition to health IT and informatics. The Pause and Pivot webinar series is designed to imbue impacted federal workers and government contractors with new skills and insights to prepare them for taking a moment to pause, breathe, assess what's going on with their lives, and pivot into whatever is next in their professional careers. So I want to introduce Dr. Erin Van Dyke, one of our graduate program directors here at UMBC, who will be leading today's session.
Wonderful. Thank you so much, Rex. And thank you all so much for joining us today. I really appreciate having you attend today's session. And I'm very excited to be able to share with you about this industry that I care about so much and that really is wonderful for professionals from all pathways, but especially for career changers. This is really a wonderful area for our professionals, and I'm looking forward to being able to tell you a little bit more about why. So in terms of our agenda for today, we're going to be starting a little bit about looking at exactly what is health IT and informatics. When we say that, what exactly do we mean? And why exactly is this a good field to look into today? We're going to be looking more in depth to some of the high demand career paths within this field. And then at that point, looking at some of the different kinds of skills that you may have from your past positions, your past experience, and how you can translate that into a career in health IT to use that to pivot into the next stage of your career. And then in addition to that, different kinds of strategies for success that you can use to be able to accelerate that pivot. And then finally, at the end, time for a Q&A. So first, when we're looking at defining what exactly is health IT and informatics. So when we look at health IT versus informatics, these two terms are very highly related. They are two interconnected concepts and fields that really do sit. They sit at the intersection of healthcare, data, and technology. One of the key differences that really separates them is that when we talk about health IT, we're speaking more about the actual application of information technology, thinking about how we're actually using the technology to be able to manage the health information, to be able to, for example, work with electronic health records, health information exchanges, telemedicine, and the different roles within this particular field are going to be focusing more on, for example, infrastructure, establishing systems to be able to support the management of that health information, and of course being able to secure data flow as well. Whereas when we're looking at health informatics, this is more of the science of how that health information is collected, stored, retrieved, and utilized, and being able to then utilize that to be able to improve patient care, research, and public health. So what we're going to be talking a little bit more during today's session is how some of those particular roles are going to be, you're going to see more of a focus on data analysis, decision support, and knowledge management based upon the actual science and insights gathered from that information. So let's talk a little bit about why health IT now. Why is this a field that I really feel it could be a great opportunity for career changers? Well, first, this has been an area where we've been seeing a lot of growth and development over the years, and that has only continued to increase. And we're seeing fantastic signs of that continuing to grow as time goes on as well. There's been a great shift in digital transformation as as different hospitals, clinics, organizations, and systems have been making the transition from paper records over to electronic. And this has only been further accelerated by, of course, recent global health events. Of course, certainly thinking about the recent pandemic has, of course, accelerated, for example, telemedicine, telehealth, as well as remote monitoring for patients. We also have to consider the fact that we have aging populations, management of chronic diseases, and with this, what this brings is a lot of new challenges, a lot of new opportunities as well to be able to develop new data-driven solutions. And so there's really a great need in our industry for professionals to be able to bring in new insights and solutions to be able to address these. We also have various different regulatory demands and government mandates we have to consider to be they're ultimately are going to be driving the adoption of IT solutions. So we need professionals who are aware of these, understand the importance of them, and are able to apply that into their work. We have the importance of big data, so recognizing that we are collecting mass amounts of data throughout in terms of individual patients, going off individual clinics, larger hospital systems, and then even taking a step even further back, looking at the larger population health level as well. So what can we do to be able to take all of this mass amount of data and be able to use that to be able to provide insights that ultimately are going to help to support better healthcare? And then we continue to see further innovations as well, of course, such as artificial intelligence, machine learning, precision medicine. And with each of these new innovations that are being implemented and are being integrated into healthcare and, of course, into health IT and informatics, this is actually creating new roles, new needs, new opportunities, and which is a very exciting time in our field to be able to have professionals be able to help to really meet those challenges as they arise. And then another reason that I think is really important to note is that healthcare as a whole, and this includes health IT as well, is really a resilient sector. And these roles, of course, directly contribute to public well-being, which for many in our field just brings a great deal of personal significance and is a really big factor for why we are in this industry. I also want to offer a few numbers as well, just to really kind of give you a sense of some of the investment that has been put into this work, and to give you a sense of kind of that ongoing stability, the ongoing investment that we're continuing to see into this industry and into careers as well going into the future. So up to this point, the healthcare sector is projected to add nearly 2 million jobs each year over the next decade. And then one job statistic I wanted to point out here as well is you're going to see two different categories as reported by the Bureau of Labor Statistics. Now, one is for health information technologists. This actually affects several different roles within our field, are seeing a projected growth of 16%, which is much faster than the average for all occupations. But the next level up, which is medical and health services managers, which this includes the levels of health IT leadership, is even more significant than even that, projected to grow 29%, which we have seen this number grow over time. And then, of course, when we look at the larger global healthcare IT market, which just a couple of years ago was valued at $238 billion, we're continuing to see investments being made into this market, into this field as well. And based upon current projections, we're seeing this going as high, if not more, than $1.4 trillion by 2034. So again, just in terms of looking at the industry as a whole, looking at opportunities, different pathways, hopefully this gives you a bit of a sense in terms of where these opportunities lay. So now I wanted to offer a little bit more as we kind of take a step back and take a look at who exactly is employing health IT informatics, health IT and informatics professionals? Because one of the things that I think the theme we're going to be touching on during today's session is that there's various different pathways, various different opportunities that the professionals in our career in our field are able to take advantage of. And as you can see, there's multiple different domains and different kinds of employers that our professionals can look to for opportunities, whether that's hospital clinics and health systems, government tech vendors, consulting firms, working for IT support, insurance, research, or nonprofit organizations. Each of these, as we start to speak about some of the more individual roles, you'll be able to see that as you go through your job search. I highly recommend actually looking and seeking out some of these different types of employers, making sure that they're part of your larger job search, and really taking a look to see what positions are open and learning about those positions, seeing if that perhaps might align with your own professional goals as well. All right, so next we're going to be looking at some high demand career paths, first starting within the health IT domain. So this is just a small sample of some of the types of roles that you can find within health IT. But again, just to kind of give you a little bit of a sense of what kinds of positions that someone within our field might be pivoting into. So this, for example, could be an electronic health records specialist or analyst. Typically, the specialist being, pardon me, the entry level role, analyst being the senior role. And in this role, you're going to be working a lot with configuration, optimization, and training and support. Next, we have implementation specialists. Who's going to be working on the actual integration and deployment of any new IT systems. This individual, of course, needs to have a very thorough understanding of the organizations, the clinics, the context that these systems are going to be implemented in. System administrators and network engineers. Of course, you can often find these individuals in various different domains, but within healthcare, being able to understand the infrastructure that they are going to need to be able to have in place within our industry, understanding that and being able to work with the various stakeholders in our field. Likewise, with Health IT project manager. So again, project management, you're going to find in various different domains, but here you're putting it within the context of healthcare, being able to oversee those projects from start to finish and being able to bring that expertise into our context. And then finally, for this one, we have cybersecurity analyst, once again, in the context of healthcare. Of course, here you're going to be able to apply your expertise in being able to protect sensitive patient data from threats. A very, very important issue and something that, once again, we're seeing a great deal of investment in, just because it is so incredibly important that we protect patient data. Next, we're going to be looking at high demand career paths within the health informatics field. So just a couple of ones that we're going to be just highlighting for today is first we have the clinical informaticist. Now, one question that comes up from time to time with a clinical informaticist is, does that individual necessarily have to be a clinician, or can they come from a non-clinical background? And the answer to that question is that they do not necessarily have to have a clinical background. If you do have a clinical background, all the better. If it provides fantastic background context for you to be able to utilize that knowledge, to be able to really understand the clinical practice, optimizing workflows, for being able to provide the clinical decision support. But if you yourself have not worked in a clinical setting, but you are able to understand those concepts, you're able to learn about them within the healthcare setting and be able to work with those stakeholders, you can be very successful in this role. We then, of course, have the data analyst and scientist. Once again, typically we see data analyst being the entry-level role, then progressing into data scientist as part of it, into a senior or a leadership level role. And this important role is going to be extracting the insights from the health data. And based upon where they're working, the employer, what they've been tasked with, utilizing this for research, operations, or public health, among many other different domains as well. Very, very closely related to a data scientist, we also have the public health informatician. In which case, this is taking that data scientist role within public health, but applying it even more so. Now you're going to be using the data to actually monitor trends, but you're using it specifically for the purpose of preventing disease and being able to promote population health. So individuals who have that interest and that ability to be able to understand epidemiology, being able to understand that population level health, and wanting to be able to support that work. And finally, we have quality and patient safety analyst, who's going to be able to utilize the health data to be able to identify areas for improvement in care delivery. This role can work in various different levels, again, whether that's within clinics, hospitals, consulting firms, government. This is a very highly sought after position, and one that is also very closely related to it as well is specifically policy analyst as well. So anyone who has a background, say, in regulatory legislation, that can be a fantastic pathway to consider, being able to utilize your great experience and knowledge in that area. And there absolutely is a need as organizations, health systems, clinics, et cetera, absolutely do need that expertise and would greatly benefit from your knowledge. So now that we've looked at some of those examples of the in-demand positions within Health IT and Informatics, I want to speak a little bit about how to translate your skills based upon your past experiences, your past roles, and how to use that to pivot into health IT and informatics. Now, obviously, everyone's going to be coming from a different pathway, have your own experiences. So really, one of the next best steps would be actually being able to speak about a very specific role, looking at your individual resume and really being able to tailor it, which we'll be speaking about in a little bit more detail in just a moment. But I did at least want to provide just some general guidance based upon just some very common skills and background that we typically see from professionals who either are working in federal positions or other professional roles as well. So you'll see here in the table provided, you'll see just some of those common professional skills, whether they be project management, data analysis, policy, regulatory compliance, cybersecurity, training, documentation, logistics and operations, or customer service and stakeholder management. As you can see in the next column over, there's a direct equivalent that you can then be able to see both how that can directly be applied within a career within health IT and informatics, but furthermore, being able to hopefully help you be able to articulate that when you are in your job search, and being able to speak to how you can utilize the great depth and breadth of experience you have to be able to support our field. So I hope this resource may be helpful to you. Another point I wanted to make as well is that we often hear about, you'll hear the term soft skills, or more and more we're seeing them being referred to as essential skills because they really truly are just incredibly important. One of the great aspects of my role is that I get to work with our advisory group within our program. This allows me to be able to engage with different members of our community in health IT and informatics, various different leaders in the field. And so one of the questions that we will often go back and ask them is, what are the most important competencies, the most important skills that you really want to see professionals coming into the field with, so that you know that they can be successful in their job? And certainly they speak to the technical skills. That's very important to being successful in that job, in that role. But the essential skills, time and time again, are the ones that they say really allow candidates to be able to stand out. If they have that combination of the technical skills, the experience, and they can speak to their experiences and how they've applied their essential skills as well, really allows them to rise to the top. So I always make sure to be able to provide these insights as well, and it has proven to be helpful as well to job seekers in our program as well. So as you can see, the ones that we've seen most highly sought after within our program has been problem solving, critical thinking, change management, the ability to be able to adapt to change, which of course is extremely necessary in our rapid change environment that we see within healthcare and health IT and informatics. Strong attention to detail, and the ability to be able to communicate with individuals, stakeholders at various different levels. Just be making sure that you're able to provide examples of how you communicate and how how you understand the quality of your communication stood out and was successful. All right, so next we're going to be going to strategies for success, looking specifically at education and training opportunities. And so this is really an opportunity for you to be able to build a foundation in health IT and informatics, so that you can start to identify, if this is of interest to you, what particular roles you might want to go into, what pathway you might want to explore. There's several different ways to go about doing this. There's online courses and certifications. These can be offered through online courses at universities. There's courses available through Coursera, edX. One professional association I also want to call out is the Health Information Management System Society, or HIMSS. Also provides different online courses as well as certifications, which can be very helpful to being able to determine which kind of pathways are of interest to you or specializations. Boot camps and intensive programs focused on rapid skills acquisition. Sometimes you'll see these marketed as health IT boot camps. Sometimes there will be data science boot camps, which will have a healthcare component to that. So that can be a fantastic resource to look into as well. For those who are specifically looking for leadership roles, research roles, master's degrees are absolutely essential for many of those roles. And what I would encourage anyone who is interested in looking at and being able to eventually pivot or grow into those roles is to once you've identified which role you're interested in, being able to consider which particular pathway would make the most sense based upon your individual position that you're interested in. So, for example, considering an applied professional studies role for the more applied for the more applied based positions, whereas perhaps more of an academic research program if it's more, say, an actual research role. And again, this would ultimately align with your professional goals. One of the great benefits as well with master's degree program is that oftentimes an important aspect of that is the inherent advising and career guidance that comes with this. So if you are new to the field, if you're trying to find out how to best leverage your skills and experiences and where best to direct that, those of us in graduate programs are here specifically to be able to support professionals at any stage in their career and being able to help them be able to find that next step in their journey. It's also worth noting that many universities also offer non-degree programs and continuing education courses as well. So depending upon where you are, whether you're wanting to just explore opportunities or whether you're ready to be able to being able to really take a pivot into the next move, I'm hoping this will provide you with at least some different options to be able to really kind of explore some of the different pathways within our field. All right, and next we're going to look at our strategies specifically for networking and job search. So really the goal for these strategies is to be able to expand your network. Of course, through here, being able, of course, to leverage your LinkedIn, connecting with professionals in the field and follow companies that are specific to our field. And I also recommend as well taking a look once you've identified what specific companies you're interested in, if there's any particular roles that align with your particular goals or as a position that you would be interested in pursuing. Looking at being able to update your profile, making sure to highlight what skills, for example, ultimately align to both the industry as well as the individual positions of interest. As I previously mentioned, the HIMSS Professional Association. So I would once again want to call out just the importance of these professional associations within our industry. We have HIMSS, we have AMIA, the American Medical Informatics Association, ANIA, which is the American Nursing Informatics Association, as well as several others, once again, depending upon your individual specialization. And the great benefit of these for professionals at all levels, but especially for career changers, is just the access to various different resources. They offer webinars, they offer in-person events, local chapter meetings, conferences, and even events that are specifically targeted for networking and being able to connect with those in the industry, which can be a wonderful opportunity to be able to learn more about different companies, different positions, and really be able to speak to those in the know. Another way to be able to learn more information about individual positions and really kind of gain some insights about if this is a position that you would be interested in pursuing is requesting informational interviews. People are often very happy to be able to share to share their journey, share what they know. So being able to learn from those insights and being able to be able to ask them questions can be able to provide some really great feedback for you in terms of where you want to go next in into your search. Of course, obviously the importance of tailoring your resume and cover letter, and once again being able to highlight those transferable skills using keywords from job descriptions, so they ultimately are going to be able to communicate why you would be a great match for that position. Being able to explore job boards. Certainly, obviously, there's the general boards using filters that are specific to our field within LinkedIn, Indeed, etc. But there's also industry-specific job boards that I wanted to make sure to highlight as well. Within HIMSS, there's the HIMSS Job Mine website. And AMIA also has the AMIA Careers board as well on their website. So I recommend keeping an eye out on positions posted there as well. And then finally, consider internships and volunteer roles. These can be a fantastic opportunity for gaining practical experience if needed. Say, for example, you have a great deal of technical experience, but maybe you haven't had an opportunity to be able to apply that in a clinical setting. And you want to be able to do that so that you're able to position yourself to be able to pivot into one of the roles that would make you a competitive candidate for one of those positions. Being able to seek out a position like this would be able to get you that experience and be able to help to accelerate that goal. So in summary from today's session, Health IT, Health Informatics is a continuously expanding field. It has diverse opportunities, just various different pathways for individuals and professionals to be able to take their existing skills, take their strengths, and to be able to apply that and to be able to apply that moving forward to a position that they can feel very very happy with, and one where they're able to utilize those great skills and experiences. The fact that you can utilize strategic education and certifications to accelerate your pivot. Being able to look at strategic networking and targeted job searches, which are essential for success. And then, of course, being able to seek out opportunities to be able to locate jobs that once again meet your professional goals. And again, considering a position in Health IT and Informatics, to be able to make a significant impact in healthcare and being able to contribute to this growing industry. All right, and with that, I will conclude this session and switch it over to Q&A and conclusion. Rex?
Thank you so much, Erin, for that session. I know that I got a lot from it. I know that figuring out what's next can be confusing, but I think you gave us a lot of great insights on how to potentially do a career pivot into HIT. So while the chat is open for any questions or concerns attendees might have, we're also going to link our exit survey. So the exit survey helps us know how this particular session went for you. It also allows you to give us insights into what you'd like to hear in future sessions. So please feel free to fill that out. We definitely benefit from your feedback. We are at time, so we'll give folks a few seconds. You want to get your questions into the chat. If not, we'll assume that Erin gave a perfect presentation, answered all questions in advance, and we'll see you all next week. Well, thank you again, Erin. We're so thankful to have you today. Hopefully someone's able to implement the things you shared today and find some new opportunities for themselves.
Absolutely. Thank you so much.